young people. And young people, knock for Micah, do not seem affected by this virus the way older people are. Also, the schools, you close schools en masse. Now you have to find out, that's tremendously disruptive to all of society, because now how does somebody go to work if their kids are going to be home? So that's a problem there. On the mass transit, first of all, the ridership is down on mass transit all across the board. So the density has come down naturally. You want to make that point?
In schools, it's something that we talked about, obviously. All the things the governor said would be so disruptive. But additionally, again, it's 40 kids in a classroom at the maximum. So what we're talking about is congregate spaces where you're packing a tremendous amount of people in. So you're talking about 40 kids. And on mass transit, just to punctuate the governor's point, we're seeing that sort of self-correct on its own. Subway ridership is down 18.5%, buses are down 15%, Metro North is down 48%, Long Island Railroad is down 31%, and the bridges and tunnels we're actually even seeing are down 7%.
Guys, let me just say this. Perspective is so important here, just a factual perspective, because the anxiety, the fear is not connected to the facts, and the anxiety and the fear can be more disruptive than the facts. Those numbers are the facts. They are the indisputable facts. With 127,000 cases as the database nationwide, those are the facts. They're not, you don't want to see anyone pass away, but those are the facts. The question now is, how do you reduce the number from past experience by reducing the spread, more testing, more density reduction, and make sure you have the hospital capacity so you can save as many lives in the hospitals as possible. That's all this is. And this is very manageable. This is very manageable. I went through Ebola. Ebola was frightening. That was frightening. That was, frankly, what the mindset is, closer to what the mindset among the public is. Ebola was very, very, very hard to cure. And if you got Ebola, you were in a serious situation. That is not the case here. That's not what the numbers say. It's not what the data says. It's not what has happened anywhere else on the globe. This is about having the system in place to manage it. Well, we didn't have the testing in place. You're right. You're right. I think that's caused anxiety for people all day long on the TV. It's we don't have enough tests, we don't have enough tests, we don't have enough tests. First of all, the tests are basically irrelevant at this point, right? You're not going to find a sample of how many people actually have the disease with the tests. That horse is out of the barn. What you're doing is identifying people who are positive so you can isolate them. That's what the tests are doing. But the tests and what we did 3 months ago, that is yesterday. What do we have to do today? What do we have to do tomorrow? Plan this emergency health management system. More testing, reduce the density, have the hospitals ready. That's what we have to do. Let's focus on what we have to do, and let's keep the anxiety to a realistic level, to the extent we can. I'm sorry. Thank you very much. I have to go to work.